Well, first of all, the misinformation about testosterone in that many physicians think that, and some clients tell me this, so you know, my doctor said you're thinking of taking testosterone, that can give you prostate cancer. And of course, the truth about the connection with prostate cancer is this. Everybody that develops prostate cancer, every single one, their testosterone is low, not high. A corollary to this is, if high testosterone correlated with prostate cancer, then that should be the disease of 25-year-old men, when all their hormones, including testosterone, is the highest. No, it's unheard of in that age group, between 20 and 30. In fact, generally, prostate cancer is a cancer of old age. Although sometimes, I mean, I've picked up a couple that were in their mid-40s. Because one of the routine things we always do in men in the blood testing is to check for the prostate-specific antigen, the blood test, the PSA. And if it's above a certain level, then I tell the person, you know, I cannot talk about hormones with you until you go see a urologist to clear you. Because sometimes when it is high, the PSA is high, it's only because of a little bit of an inflammation in the prostate. But I'm not the expert to make that determination, the urologist is. But then once in a while, God forbid, it turns out to be it's high because of a cancer. And if it is because of a cancer, then of course they're going to take care of it either surgically or by radiation and other ways. But when that person is cured of his prostate cancer, we give them testosterone. No problem. Although, in the few cases I've had in that category, I always say, the doctor that saved your life, whether it was the oncologist or the surgeon, how does he feel about you taking testosterone? As a professional courtesy to what the doctor feels. And in every case you say, we discuss it with him and he feels no problem. So that makes me feel better to start him on testosterone. And then of course on these cases, if it's a fresh case like they just cured it a year ago or something, we get PSA every 3 months. And of course they also, by definition, are seeing a urologist every once in a while to be checked and stuff. But if I'm actively taking care of them, then I make a point getting that PSA every 3 months on a routine basis, because I want to always see it very tiny. Because that's by definition means there is no activity in the prostate, that it's been already totally removed. Removed or killed, because I mean with radiation you don't remove it, but you kill all the cells of the prostate. So that's how we handle that. So it's definitely a misinformation to say elevating a testosterone level is going to increase the person's chances to get prostate cancer. It's pure rubbish. There is no evidence of that anywhere, and certainly statistically that's not what we see. In addition to that, there is also new science, both from Europe and the United States, indicating that the prostate has an autoregulation within the gland. In other words, whether the testosterone level in the blood is high or low, the prostate will take the amount that it needs. So that's like additional evidence that whether you have high testosterone, it's not really an issue to say, oh my God, now my testosterone is getting higher, so therefore there's a more likely problem with the prostate. It just is not, it's just not the way it is, completely. So, we talked about acne, losing hair, getting more aggressive, having trouble falling asleep at night because the brain is still going, all the circuits are connecting and moving at a high speed. They're unable to decompress, so you can, fall asleep. Yeah, these are the the most common is acne. I mean, you start testosterone and you have acne, say 5 weeks later, we better check the blood level. And very often it's a little higher than it should be. So then we reduce the dose. Of course, in general, when you start out, based on your experience, you try to give a dose that may end up being a little shy of the right dose. But that's a lot smoother way, because the worst that can happen is that 4 or 5 weeks go by and the guy calls back and says, I'm not feeling anything happening. So you increase the dose a little bit. Whereas if you start with a liberal dose and then get side effects, and even though you reduce it immediately, but the side effect may take months and months to go away, like acne, for example.